Today we're going to demonstrate our technique for ACL repair with internal brace. This is a newer technique that allows us to repair certain ACLs to reduce and eliminate the need for a reconstruction. So here you have an excellent candidate with a proximal tear with good tissue for the remainder of the ACL. We perform a very straightforward small notchplasty. This not only improves visualization, but will allow us to further stimulate the femoral attachment. We then do a figure 4 technique to allow us to pull the proximal tear off of the wall and remove any scar tissue to improve the healing potential. And this also allows us to identify the footprint. Following this, we will use a microfracture awl. A power pick will also work in these situations. Again, this will stimulate stem cell ingrowth and has demonstrated improved healing for ACL repairs. Again, this technique we are demonstrating is a newer technique that was just recently developed. You can see we're using a 4-0 spade tip to drill through the femoral side, and then we will pass a passing suture, and we'll keep this out of the way to avoid suture issues. This is a cannulated guide pin using the bull reamer, and then we'll pass a nitinol passing suture. This will be used for our internal braces. We put this through the anterior medial bundle of the ACL. We will pull this out of the lateral portal as well for suture management, and then we will perform our passes. It's important to do this first to avoid truncating your fiber rings. We are using a knee scorpion here. We are passing through the AM bundle, and we are passing a 35mm fiber ring in this situation. And then we will change the scope position and pull this initial distal fiber ring out of the lateral portal for suture management. It's important here not to take bites too proximal on the ACL as the tissue is of less good quality lower down. Here we reverse the scorpion and pass from another direction so these fiber rings are not interfering with each other when they're pulled in. Here we've got good tissue bites of both. This is a 25mm. Then we are cutting and passing this tightrope system for the ACL repair, first through the first fiber ring, followed by through the second fiber ring. And the card demonstration of this can be found on the website. So now we've passed both of the fiber rings through the tightrope device, and then we will pass the tightrope device up through the femoral tunnel. And here we are slowly pulling the new tightrope 2-button device up into the tunnel. This has a more ergonomic and reduced pullout issues. Following here, we are slowly tensioning the tightrope, which will also tension the fiber rings and repair the ACL back. It's important here with the internal brace to hold on to internal brace during this technique, as it will prevent the button from pulling into the IT band. Following here, you can already see we've had good tension, but we will further tension this. Before final tensioning, we are pulling the passing suture through the tibia, and we're pulling the internal brace through the center of the ACL as biomechanical studies have demonstrated significant improvement in strength. You can see here we're doing a Lockman, is complete return to 1A, and an anterior drawer. Here we're now probing after we've further cycled the knee and further tensioned down the tightrope. There is complete return of the ACL tension, and this demonstrates good overall biomechanical strength, and we've seen a very low re-tear rate of around 5 to 7% with this technique. Hope you enjoyed it.